Okay, I had a question submitted to me today, and it is from a 33-year-old woman. She said she's never had a baby or been sexually active. She has autism and she has very severe anxiety. She has a phobia of developing chronic problems in the pelvic floor area. And when something re-triggered that anxiety a few months ago, she started clenching. Because remember, the pelvic floor has a lot of muscles. So what it sounds like she's been doing is clenching the muscles down here because of that phobia. So now she says the muscles can't seem to unclench, and I feel pressure and mild nerve and muscle pain, and is asking what she can do. So, first of all, thank you so much for reaching out. Second of all, I want to reassure you that these are muscles. And yes, there are nerves in the area too. And if something is clenching or tightening these muscles, whether it's you tensioning them, whether it's stress making you tension them, sometimes those small nerves that go through the muscles can be pinched a little. So it can cause some of the symptoms that you're describing. So, again, first of all, I just want to reassure you, and there's lots we can do to help with muscles. But the second big point I would say is there's not one thing I can tell you today to make that better. You really, with what you described, would do much better talking with a healthcare provider who has an understanding of this area of the body. Now, that can be somebody like myself, a pelvic health physical therapist. It can be an OB-GYN if you have a relationship with an OB-GYN. It could be a midwife, but you really want somebody who has experience in this area so that they can get you relief as soon as possible and take into account all the different factors that you shared. The other thing I'd say is you could go to my website. It's called mypelvictherapy.com/relax. Okay. If you go to that website, you can sign up to get a free PDF that does have some things that help you relax your pelvic floor muscles. Because again, if you've been clenching a lot in these muscles, we want to do the opposite. We want to relax them. Just as if you had a real tight muscle up in your upper trapezius, which is the big muscle right here. You want to massage it out. You want to stretch it. You want to relax it to make it feel better. So in the pelvis, it's the same type of muscle there, and we want to do kind of similar things there. So you can get a little bit of guidance at mypelvictherapy.com/relax. But your main action is going to be to reach out to a healthcare provider who understands this area better so that you can really get really accurate and effective treatment. Thanks so much for reaching out. I wish you all the best.